Thanks to all of you for tuning in. We wish so much that we were with you in person today for this annual event, but we are optimistic and hopeful that we will be back in person for events like these in the very near future. In the meantime, we're honored to have a truly wonderful panel of some of the state's leading healthcare legislators with us. I am thrilled to introduce Representative Rob Summerfield, Representative Lisa Subeck, Senator Mary Felzkowski, Senator LaTonya Johnson, and Sean Kirkby, Assistant Editor for Wisconsin Health News, who will be moderating today's event. Before we get started, I want to make sure we thank our very generous sponsors of the Wisconsin Health News panel series. These important discussions truly would not be possible without their support. So a huge thank you to Ascension Wisconsin, Group Health Cooperative of South Central Wisconsin, Marshfield Clinic Health System, Wisconsin Medical Society, and Novo Nordisk. Thank you also to Badger Bay Management for hosting today's event in partnership with Wisconsin Health News. Wisconsin Health News is an online, nonpartisan news service. In addition to hosting events like these, we also publish a daily email newsletter. If you're not yet a subscriber, I encourage you to sign up for a free trial. You can sign up on our website at wisconsinhealthnews.com or through the event evaluation form, which we'll email out after today's event. And I want to give an extra thanks today to Group Health Cooperative of South Central Wisconsin, today's featured sponsor. We are very grateful for all of their very generous support. And here to say a few words is Marty Anderson, Chief Strategy and Business Development Officer for Group Health.
Thanks, Tim. Good afternoon and welcome to the panelists and virtual viewers to this important conversation. I'm Marty Anderson, Chief Strategy and Business Development Officer at Group Health Cooperative of South Central Wisconsin. For those of you that don't know, Group Health Cooperative is a staff model HMO serving 80,000 members in South Central Wisconsin, primarily in the commercially insured market. We're pleased to sponsor Wisconsin Health News and critical discussions like the one we're having this afternoon. The challenges in healthcare are numerous, including the continuing pandemic, staff shortages, ensuring equitable access to care for all, and healthcare financing. The right public policy can have immeasurable impact on the lives of our members and residents throughout the state. I'm excited to hear the dialogue this afternoon and have faith in the Wisconsin state motto of forward.
Excellent. Thank you so much, Marty. Some great words to get us started. Thanks again to Group Health for all of your generous support. With that, I'm going to hand over to Sean to lead today's discussion. Sean, take it away.
Thanks, Tim. And thanks to our panelists for taking time from their busy schedules to join us today. The legislative session is set to wrap up in the next month or so. And I'd like to kind of hear from each of the panelists on this question. What are your top priorities for health-related issues? And why don't we start with Representative Summerfield?
Yeah, thanks for having me here today. I think one of the biggest things continuing to work on, there's a wide variety of, things that we've been dealing with throughout, the session with access, the workforce, etc. What I've been really since probably the last 3 years, really working on telehealth. I think telehealth is super important, especially for us up here in the more rural areas. Granted, my district's it's super rural, but everyone in my district is within 30 miles of a hospital in either Eau Claire, Chippewa Falls, Menominee. But saying that still for some people, an hour or half an hour each way, an hour drive. Some of them are homebound, need to have a sibling, a child, neighbor, I take them in there just for routine medical care. And I think now with where the technology is with telehealth, it's, trying to break down the barriers, which last session we did. I know our Representative Amy Laudenbach had a great bill for Medicaid with telehealth is, continue to expand on our opportunities with telehealth. I know there's barriers with the bureaucracy on making sure things get they're paid for, etc., at the right rates. But the more and more we can look into telehealth, because I think on the long end, I see it as a long-term investment, that the more and more we use telehealth, that people not, waste, 2 hours of their time driving to be able to do the routine checkups through the telehealth. And if all of a sudden there is something of concern, then bring them in. Or even, I know in my region, I had a chance to visit St. Joe's Hospital in Chippewa Falls, I think about a year and a half ago, about their stroke. For someone coming that could have a stroke, put you up to telehealth and they can talk to experts, within their system that's not in the hospital at this time to say, hey, yeah, this person is a stroke. This is what we need to do to provide care for them. So I think the limit, or it's unlimited possibilities with telehealth, but we have to continue to make it a priority for us in the state of Wisconsin, especially for the rural areas.
Representative Subeck, what are you looking forward to doing in the next few months about health-related issues in the legislature?
Sure. So I think, obviously the elephant in the room, so to speak, is that we're still in the midst of a pandemic. And we have to get that under control. We have to figure out how we support or continue to support our hospitals and our workforce through this pandemic. I mean, it was not too many weeks ago, just in the last couple of weeks, that I was hearing from hospitals in my district. And I know we are hearing this across the state in various areas about not having beds available, particularly for ICU patients. So we need to, first and foremost, continue to provide that support, both from a legislative perspective, also from an administrative perspective, in any way that we can possibly do so. Beyond that, I do agree that we need to address the workforce issues. We have been working hard over a number of years to try to grow the workforce, particularly in our rural areas and in some of our underserved urban areas. Those challenges persist, and they persist nationally. So Wisconsin isn't going to solve that alone. We need to look to how to also be part of a national strategy. I would say we're not going to do it in this legislative session, clearly, because the majority party has not shown interest in it. But one of the best things we could do to address a whole wealth of issues is to expand Badger Care. If we want to expand access to healthcare, increase payments, do a whole wealth of issues I'm sure we're going to talk about today, we do need to expand Badger Care. It is shameful that we are now one of only a handful of states that has not yet done so, and we are missing opportunities that other states are taking advantage of.
Senator Johnson, how about you? What are your priorities for the rest of the session for health?
Well, I have numerous priorities. Some of those are, as Representative Subeck said, to expand Badger Care. Unfortunately, I am the wrong person to ask what can be passed during our last month or so in session, because I'm not a part of the majority party. And the majority party dictates what will be passed, what will be brought to committees, what will be brought to the floor. And unfortunately, that's not something that I have a say-so in. But expanding Badger Care is a #1 priority for me, especially for communities of color. We have seen enormous disparities for communities of color. And, as Representative Subeck pointed out, we're in the middle of a pandemic. And African-American communities, BIPOC communities have suffered greatly because of these disparities. And then on top of that, a pandemic. But I wouldn't just stop with expanding Badger Care. I would raise the rates, because we know that all care isn't equitable care. There are things that our private pay insurers have that, our Medicaid insurers don't. Infant mortality is huge in the African-American community. Our disparities for infant mortality is one of the biggest in the nation. And so making sure that we raise rates for our OBGYNs and those individuals that have to care for those individuals is extremely important in making sure that they can find adequate care.
Senator Felzkowski, we're talking a little bit about legislative priorities in the last month or so of the session. Just was wondering, what are your top priorities for health-related issues as the session comes to an end here?
Well, I think a lot of we did a lot in the budget, and I'm very happy with what we did in the budget about raising rates, dental access. I would love to see us get dental therapy and FDAs across the finish line. We did dental therapy through the Senate, but I know Speaker Voss is blocking it in the Assembly, so that's a very large disappointment for me, because the access to oral health care and the lack thereof is huge in the state of Wisconsin. But I would also like to see us get a hearing on medical marijuana in the Senate, so that we can start to have the conversation around giving people access to a natural alternative instead of just prescription drugs.
So Senator Felzkowski, you chair the Committee on Insurance, Licensing, and Forestry, which held a public hearing last month on a measure that targets the practice of white bagging. where insurers select a source for clinician-administered drugs rather than providers. Employers and health plans argue that metric goes beyond that. Can you talk about where you first stand on this proposal, and do you plan to move it forward this session?
It will not get an exec on it. We don't have the votes to exec it out of committee. I think this is a situation where the health plans as well as the hospitals have a lot of work to do. And I think this is something that they need to contractually come together and figure out. We did hear from some of the health plans that certain hospitals are accepting the negotiated rates so that they can continue to administrate those drugs with a bill and bill and distribute process. So we have insurance companies saying that they're doing this to help control costs. Hospitals are saying that this is around patient advocacy, yet we're hearing that hospitals are marking these drugs up 200 to 400%. So we're very much hoping that they're, after having held the hearing, that the hospitals and the insurance companies work this out without the legislature getting involved in the middle of these contracts.
Senator Johnson, you've signed on to support this legislation. Can you talk a little bit about why you support it? Oh, I think you're on mute, Senator.
You're right. I should know how to work Zoom by now, but it's still a challenge. I think the number one reason is patient safety, making sure that, that patients get adequate care, they get access to the resources that they need, and they're able to gain that access where they are, that they're able to choose where those resources come from rather than the provider or the insurer. I think that's extremely important. We want to make sure that, people with debilitating diseases have access to the medications that they need. So patient safety is front and foremost.
The Assembly Committee on Health is planning a hearing on this next week. Representative Summerfield, you vice chair that committee. Where do you stand on this plan? And do you see further action needed to address the high costs of specialty drugs?
Yeah, I think, bringing this proposal forward, they put it really on the front burner. I think many people aren't aware of this practice. And I think now, as Senator Felzkowski has mentioned, bring them together and hopefully they can figure it out on their own without our legislative, action. My biggest concern, I'm on the bill. It's if the medicine's, in two rooms away, why can't they use it? In going through all these hoops, talking, on the phone, put the family through a lot of distress, that this needs to be taken care of. I'm hoping that, even if legislation does not come for tuition, that, both sides, hospitals and insurance, can get together and make a common sense compromise to make sure that we have a care for our citizens in the state of Wisconsin. I think that's my biggest reason for, supporting this bill. We need, for the patients, best care for them.
Representative Subeck, you've served on the governor's task force on reducing prescription drug prices. Do you support this proposal? And what further action do you see needed to drive down drug prices in the state?
Thank you. Well, I'm looking forward to the hearing next week. I acknowledge that we have a problem. It's as one of the previous speakers indicated, and I don't remember which one, lots of people, I think it was Representative Summerfield, lots of people don't even know about this. And I have to say, I was one of those people until a few months ago when this bill surfaced. This is fairly new to me. I was not aware of this practice or the concerns around it. Certainly, I've heard from folks on both sides of the equation, both the payers and the providers. And I think it's something that we need a solution to. I look forward to the hearing because I'm still fairly new to this issue and I'd like to hear more before drawing a definite conclusion on what that solution is. That said, it is something we need to resolve. Interestingly, on that task force you mentioned, this issue never came up. It was not something that we heard about during our task force deliberations. And therefore, it's not something, that would have been a great opportunity when we had all facets in the same room. I mean, that was where we had payers, we had folks from the pharmaceutical industry, we had pharmacists. You sort of take the gamut of the prescription drug supply chain And we covered that together with advocates, consumers, hospitals. And so I would really like to have that kind of a discussion about this issue to determine whether this is the right solution or if there are other solutions we should look toward. I'm hoping the hearing next week gives us an opportunity to do that. I recently introduced the package of prescription drug pricing reforms that really were all recommendations that came out of that committee. And I am hopeful that at some point those will also get hearings and see the light of day. Unfortunately, as happens too often in our highly partisan environment, these were recommendations that came out of the governor's task force, and the Republicans have shown no interest in giving them a hearing or moving them forward. I'm hoping that in due time we can come together and work together on that. I'd hate to see partisanship get in the way of reducing prescription drug prices.
I'm going to stick with you for the next couple of questions, Representative Subeck. You mentioned on the onset that healthcare, like many industries, is facing workforce shortages. Can you talk about what more you see lawmakers doing to address this, particularly for long-term care providers?
Sure. So our long-term care providers are one of the biggest struggles. That's folks that I hear a lot from. I think in the Capitol, we hear a lot, particularly from the nursing homes. But I'm also hearing a lot locally here, and I'm sure my colleagues are too, from the providers who provide in-home care, the folks who serve individuals for family care who are living in their own homes but require a whole wealth of personal care services, whether that's actually nursing services or other personal care. And that workforce is dwindling, and through the pandemic, it's reached crisis proportions. But frankly, it was there before that. We were already struggling prior to that. I think there are a few things that we can do. One, we have to look at the turnover in that industry. The turnover is huge. If we could retain CNAs and personal care workers, that would go a long way to toward solving the problem. It's not just a front end problem of bringing them in. I think largely it's been tackled from the front end, sort of looked at how do we reduce training requirements, those sorts of things. And while all of that contributes, I think we are missing the boat by not looking at retention. And we have to increase pay. And what we have to do that is we have to raise those reimbursement rates under Medicaid. I mean, there is little short of that we can do that is going to make a difference. We also have to look at, why don't CNAs and personal care workers feel valued? I've read the studies that the industry has put out and others have put out, and pay is one huge piece of the puzzle. The other thing is that folks in these industries are not treated like the professionals that they should be treated like, and we have got to change that. We have to improve the working conditions. We have to make sure they have access to family care and insurance and things that professionals in other environments do, in order to make sure that when we recruit somebody who is really good. I mean, I've heard some of my colleagues, particularly when there was a task force on this, there was one Republican senator in particular, I remember talking about how these are folks who do this work out of the goodness of their heart, right? Because they're caregivers. The reality is that may be true, but that doesn't pay the bills. You have to be able to put food on the table for your kids. You have to be able to put a roof over your head. You have to be treated with dignity. And that is what will get people to stay. I know the folks in this industry are trying, but they need our support and our help to do that. And that begins with increasing those reimbursement rates significantly.
Another issue just kind of connected to the field of nursing. There's been a bill that's been moving forward that would overhaul licensure for advanced practice registered nurses in the state. I believe you voted against this in the Assembly executive session on this. Can you talk a little bit about your position on this bill, and do you plan to see changes to it? And if so, what type of changes would you like to see?
Absolutely. So the APRN bill is actually a bill that I've supported in the past. I was one of the lead authors. Representative Rohrkast and I last session introduced, I don't want to say this bill because it was significantly different, but a bill that was working toward the same effort. I think this is one of those moments where the devil is in the details. I absolutely support licensure of APRNs and creating this category of licensing that I think makes much better sense for these various groups of advanced practice nurses. I just don't think this bill is quite there yet. And there are a number of issues we've been working on. Folks who followed this through the hearing in the executive committee know that there was bipartisan support for the bill and bipartisan opposition to the bill. And I think that for those of us who were opposed to the bill at this moment, there was a lot of agreement on what the problems were, and they dealt with three primary categories. One was ensuring that before somebody goes out and practices completely independently, they have some supervised or collaborative experience doing that. And I think that's one of the biggest sticking points. Second was some titling protection, and the third dealt with the ability of certain categories of APRNs to open independent pain clinics and how that influences pain medicine. Since that executive session, there have been a bipartisan group of legislators along with the full gamut of stakeholders who have come together to talk about this and try to work through some amendments. I think we are really close, but we're not there yet. I am hopeful that we will get there by the end of the session. I mean, this is a bill that I want to support, but we have got to work through these three critical areas before I can do that. And I think there are a number of others on both sides of the political aisle who feel that way.
Thanks, Representative. Representative Summerfield, wanted to switch to you on this question. Do you see changes needed to that bill? And if so, what are they?
To the APRN bill?
Yes.
Correct. Yes. I did vote in committee for it just to move it along in the process. I do have hesitations, on the three, main points that Representative Subeck has discussed. Been working with all the stakeholders involved, trying to get everybody to an okay point. I know it's not going to be, everybody's going to be happy at the end of the day, they got everything, but this is something that we need APRNs, in our areas, especially the rural areas. I'm optimistic, continuing to look for the supervision part, making sure that there's protections that we can move this along, because, I even tell people, let's at least get this started. In 2-3 years, if this is, doing really well, maybe we can ease up on some of these things, use some of these that the author has suggested, but to, get everybody to a comfort zone, I feel that we should, take, these amendments up, work with everybody, get to them okay. And I'm happy if I'm around here in a couple of years to relook at it, see, do we revamp it, or do we say this is working super well, let's even go further than what we're doing right now? So right now it's the middle of the process. I'm working with colleagues on both sides and, with all stakeholders to hopefully come up with agreement in the next couple of weeks to get this bill moving forward.
You mentioned the importance of this bill in potentially rural areas. Can you talk a little bit more about what more needs to be done to address healthcare workforce issues in rural Wisconsin? Yeah,
there's a lot. I mean, I know laying off, a small segment of your population, not wanting to get vaccinated. I don't agree with that, just because I think everybody hands on deck. But since we're past that point, now we have to look at, what to go in the future. This didn't just come up 2 years ago or 4 years ago. I mean, it's been trending quite a bit, especially in the rural areas. I'm fortunate for where I represent. It's right next door, 2 miles. My district goes from UW-Eau Claire and Chippewa Valley Technical Colleges, who have really taken a lead in our area, and I think in the state, on making sure, how we get nursing. The big, things that there's more than just one, caveat that makes it a challenge, to get people coming to working into this. Nursing, it's a 24/7 hour job. Once you work in the ERs, the NICUs, etc. It's a different lifestyle. And I'm so thankful. I've got friends, constituents, just people I know that do take this, job, with all, not the glory into it. Working with the UW-Eau Claire, especially and the Chippewa Valley Technical College, seeing, what ways we can get more students in the pipeline. I know with having, students come in to teach, there's, kind of the professors right now, or the instructors are getting to the retirement age, and it doesn't seem like there's many people that know about it or have the opportunities to leave their current job to go switch kind of careers into the nursing teaching profession. Those are things that, I think talking to students, I can use my area as a perfect example, saying, hey, you can, graduate from high school, go to technical college or the university and stay in our area and come out with a very good wage. And that's where I really see us having the opportunity to continue to promote it. It has its challenges. It does take a very special type of person to get into the healthcare field, and we need them. We truly need them. And this is where we're trying, I've been trying to work with, what licensing regulations we may need to look at. And this is, I think, why the APRN bill came out there to say, hey, this is another opportunity. And we need to continue to look to other opportunities of thinking outside of the box, especially in the rural areas, to get our healthcare workers for those needs.
For rural healthcare, just to follow up, in terms of emergency medical services, there are some issues with recruitment, particularly in rural areas where services are strained. Some people are calling for substantial investments to transition away from volunteer models. What's your take on this? What do you think needs to be done to help with EMS shortages?
Yeah, EMS shortages is just not a one size fits all. Something that works in Cornell doesn't work in Madison or Eau Claire and Cornell, even two closer areas. I think we need to, continue, to figure out how we, encourage the volunteers and not burn them out. I use an example as my dad was an EMT starting back in the late 70s. He told me his one job was to get the patient into the ambulance and get them to the hospital as soon as possible. And then they started to continue put on more and more training, which I think everybody agree training is good, but there's also a certain point is, in the township of Ruby, they can't afford, even if they partnership with 6 different townships in 2 cities, they can't afford to have a full-time EMT or full-time paramedic. So I've had ideas. I know we've done a few bills, like have maybe 1 paramedic and 1 low-end EMT. Have the low-end EMT be the driver, and the paramedic, can do it. And if something does come arrive, the paramedic does have the second set of hands to do it. Because to ask someone, 30 years old, 35, 2 kids, job, living their life, volunteering for sports, to ask them to do 120 hours a week for 120 hours of training to get as an EMT, as a volunteer EMT, it's just not going to happen. And I think we need to seriously look at that model that we started with. Hey, let's work with, the baseline. Madison is going to be completely different. It's a metropolitan. They've got full-time medics, EMTs, etc. But in the more rural areas, let's see what can work best so we at least have care. Because that's my biggest fear is we drive out all these volunteers who just get burnt out, can't do it, then we're left with nothing. And I think having something is better than nothing. And this is where we continue to, need to look forward to see what's best, not purely for the whole state, but for certain segments such as rural versus urban.
Thanks. So Senator Felzkowski, you've introduced legislation that would allow for a further drawdown of federal Medicaid funds for EMS. Can you talk a little bit about that plan and what else do you see is needed to help rural EMS?
So actually it's FMAP. So it's like we do with the nursing home bed tax. So we do an assessment on the EMS, allows us to draw down federal funds, which allows for larger, and that's actually going to help. It's going to help your larger municipalities more than it's actually going to help rural, but it is still a help to rural. One of the other things that I think we can do is we statutorily mandate that towns provide EMS, but we don't allow them to assess for it. We allow counties to levy for it, but they don't have to provide it. So I think there's some tweaks in the law that we can do. But I also think it comes down to what are we requesting our volunteers to do? Representative Summerfield touched on this. If you are in a car accident, do you need a paramedic to be the first one to get there? Or do you need somebody that knows how to, get you out of that vehicle, stabilize you, apply a tourniquet, stop the bleeding? Yes, we would love to have paramedics, but there's a cost associated with that. And we need to start recognizing our volunteers and what they do. and make it easier for people to be those volunteers instead of like piling on, all these training requirements. We're not going to let untrained people out there, but we need to find, I always say, legislation's about balance. Finding that balance as to what's absolutely necessary and what's overkill on some of these things. Because you want that first person to respond and mitigate the situation until the paramedics can get there.
Another industry that's kind of facing some significant challenges with workforce that we've been talking about is long-term care. You serve on the Joint Finance Committee, which invested heavily in the last budget into nursing homes and other long-term care facilities. What do you think is needed to address provider shortages in community-based long-term care for folks with disabilities and older adults?
So we did, as you said, we invested heavily in it in this last budget. That's never going to go away. Every budget cycle that we're going to have up, then Governor Evers did put additional funds into that. We talk a lot about the workforce, but we also have to make sure that our participation rate in the workforce is up there. We need people engaged and we need people back into the workforce. But every time we have a budget cycle coming up, we're going to have to look at those wages. Are we competitive? And if we're not, that's where our investment needs to be. We're going to have to start dialing down between needs and wants, and we're going to have to specifically go to what's needed and really focus our dollars on the most vulnerable in our society and taking care of them.
When the next budget comes up, do you see any need for further rate reform for long-term care services or putting additional resources towards that sector?
If we're trending in the same way that we are now, absolutely. If there's no personal care workers because we're not paying them enough, then we're going to have to address that. But I think our workforce, we're going to have to make sure that our people are participating in the workforce also, and not sitting on the sidelines. So that's going to be another issue to address workforce challenges across the board in the state of Wisconsin.
Tied with the budget a little bit is some proposals to move and advance postpartum care on Medicaid. Your committee held a public hearing last fall on a measure that would extend postpartum Medicaid coverage to a year after birth. Where does that effort stand currently? And do you expect it to move forward this session?
We are looking for the votes to do so. As of right now, we do not have the votes to move the bill through the Senate. So it is on hold. I am a large supporter of it, as well as Senator Ballwig. So if it doesn't move this session, I know we will be bringing it back next.
What sort of other plans do you see needed to reduce the number of maternal newborn deaths in Wisconsin and do more work around maternal care?
I think education is a large part of that. I would like to see us start in the schools, and I would like us to have better education to young women about, what does it mean having children earlier in life versus, getting your education, having children later in life when you are probably more mentally and physically prepared and probably more financially prepared. I think those are great places to start. We know that young women, when they have children at a young age, they don't finish, they're more likely to be in poverty for the rest of their life. And we need to break that cycle. And I think education when they're younger is a great way to start that. In the meantime, we need to invest in programs where when these young ladies are having children, and maybe they're that single parent or they don't have a good support system, we need to make sure that they do have a support system, well baby care, healthy mother care, and get them educated on the best way to care for themselves as well as their children.
Thanks, Senator. Senator Johnson, could you talk a little bit about, do you support this extension of postpartum Medicaid coverage to a year after birth? And what other plans do you have to reduce the number of maternal and newborn deaths in the state?
I do support that proposal. That is extremely important in making sure that those mothers have up to a year to get and receive the health care that they need. The other thing that we need to keep in mind is that it's not just young mothers who are experiencing infant mortality. The gamut is across age ranges and it's across economic barriers, especially in terms of African American women. We are seeing women, such as myself, with college degrees who are experiencing problems with premature birth weight. My daughter was born 3 days shy of 32 weeks at 3 pounds, 15 ounces, and I had a college degree. So we are seeing those things. Some of the other things that I would like to see is higher rates for OBGYNs. I've heard numerous doctors tell me that they don't accept Medicaid patients in terms of prenatal health care because the payments aren't high enough. And that's the issue, especially when we look at the disparities among African American women. Infant deaths among African American women are 14%, is 14.6 deaths compared to 1,000 live births. For our Caucasian counterparts, that's 4.9 deaths per every 1,000 live births. And if you come from an impoverished zip code like 53206, which is one of the zip codes that I represent, that's 29 deaths. So even depending on your zip code, infant mortality, the rates can be greater. And African American women are 5 times more likely to die during childbirth than their white counterparts. And these are all issues that need to be addressed. Some of the other things that we could do is to remove the sales tax on breastfeeding equipment to make sure that our low income and impoverished families have the opportunity to get those to get that equipment and not have to pay, the sales tax, especially if it's already a financial burden. Making sure that we allow doulas to go in and provide funding for them to do in-home visits. The one thing that we do know is that not all women make it to their postpartum examination. A lot of our infants are not making it to that 6-week checkup. This allows doulas to go in when the child is at least 2 weeks to have that conversation with the moms, to check on those babies and to provide that extra layer of support. Even mental health assessments would help because we know there are so many moms that are experiencing postpartum depression. So making sure that we do what we need to do there. And to establish pregnancy as a pre-qualifying event for employer-sponsored healthcare plans is extremely, extremely important. And making sure that we have dental care for pregnant women is also something that we need to look into as well. But if I had, my golden wish to address infant mortality, it would be to reinstate those home visits from nurses when children are first born. We know that a lot of our prenatal families, especially in our BIPOC communities, are at risk. They're at risk for numerous things. And getting those nurses inside that home to not only check on the mom and the baby, but to make sure that the environment is safe as well is extremely important.
Senator, you had mentioned earlier about the COVID-19 pandemic exposing a lot of health inequities in the state and disparities, and you've mentioned particularly in birth outcomes. What further actions do you see needed to address health inequities across a broader part of the population?
A lot of our African American members of the community suffer from things such as diabetes, hypertension, a whole gamut of pre-existing conditions, obesity. And so when the pandemic came to the forefront, it just exacerbated those conditions, including asthma. So making sure that those individuals have access to the medical care that they needed, especially low-income families, it was extremely difficult for them to find providers in their community willing to accept Medicaid because of the low reimbursement rates. And then when you have a pandemic such as COVID-19 that exists for such a long period of time, that makes that even more difficult to find. And for some of those individuals who are suffering from housing instability, mental health issues, poverty on top of all of these other medical conditions, it just exasperates the whole environment. Especially in terms of mental health. So making sure that we are not just providing Medicaid, but we're providing Medicaid that these low-income families can actually use, and rates that will actually allow them to get the opportunity to see providers. I know in the past when I had a daycare, and there was this one particular health insurer, and I won't say their name. When you would call, the first question that they would ask is this a private insurance or is it through the state? And if you said state, immediately no openings. But if it was a private insurance provider, then there were openings. That in itself shows that there are issues with the rates, and we have to do more to address these issues, because we're going to continue to see infant mortality rates increase. We're going to continue to see the bad outcomes and disparities among health, among our BIPOC communities, if we don't address those underlying causes.
Another sort of policy that's kind of come up a lot lately in news coverage at the Capitol is medical marijuana. Wondering, could you talk a little bit about where you stand? There are multiple proposals, including a proposal from Senator Felzkowski. Your colleague, Senator Erpenbach, introduced one yesterday, and Senator Agard has introduced full legalization last fall. Where do you stand on these bills?
I am for medical marijuana. I am for recreational marijuana. I am for anything that would control these substances and allow people to buy quality product. What we're seeing in Milwaukee and around other areas too is that these individuals are forced to buy these products off the street. And they are being laced with fentanyl, with cocaine, and with so many other things. And we are seeing overdoses in the masses. And that's a concern for me. Now, with the medical marijuana piece, all medical marijuana is not necessarily the same. I understand that parts of the legislation will allow for oils and ointments, I believe, and other things. But the fastest way for those patients to get the relief from medical marijuana is through smoking. It's through that process. And so we want to make sure that we don't leave anyone out, and that the medical marijuana aspect does what it's designed to do, which is to provide, the best aspects for the medical conditions that they're being treated. Our neighbors have approved legalized marijuana, recreational marijuana on both sides of us. And I think it's something that Wisconsin should consider.
Thank you, Senator. Senator Felzkowski, Democrats introduced their own medical marijuana bill on Monday. What is your reaction to that, and how does it kind of compare to your proposal?
So I think I'm going to give you a little history and then we'll address that. So this bill that we introduced actually was developed last session when I was in the Assembly. And what we did is, prior to last session, we had Leg Council pull together a bunch of information on other conservative red states, because our legislature is red, how they crafted their medical marijuana bill, what conditions they utilized it for, how they structured the regulatory environment around it. So then we looked at what we felt would be the best way to do it for the state of Wisconsin. When that was done, I would call them mini focus groups. We brought in colleagues from the Assembly and we sat down with them and we listened to their concerns and things that they did not want to see and things that they did want to see. So the bill that we have right now is a result of those mini focus groups, because the fact is that we have to pass this through a Republican legislature. So I know that grow your own is a big component, and that a lot of people want that. That was a non-starter. And also the smoking was a non-starter for some of the people in the Assembly last session. They did not want the smoke to be inhaled by children that may be present or others. And that's why we went with the patches, the tincture, the oils. It was more acceptable to the members of the assembly last session. So our goal this session is to have a hearing on it in the Senate. And hopefully it's a matter of getting the conversation started. People on both sides of the aisles are in favor of it. People on both sides of the aisle are against it. And we need to start the conversation, let the public weigh in on it, and come out with the best piece of legislation at the end. Because I will tell you right now, I am wise enough to know that what is introduced will not be what is passed. You know, it will be part of the process of the committee structure. I just really want to get this conversation started, because I cannot believe that we do not have medical marijuana for the people that need it the most in this state. It's a natural product without the side effects. We are okay with ODing on opioids and all kinds of other drugs for pain control that have tons of side effects, but a natural product recommended by the care of a doctor. We're not just letting people go out willy-nilly. They are under the care of a doctor. For some reason, we're not okay with that. And to me, that's mind-boggling.
When you introduced this proposal at the press conference, you said that you sort of see this as part of a broader push towards natural forms of healthcare.
Yep.
Last week, Governor Tony Evers vetoed a bill that you authored that would define practice of complementary and alternative healthcare practitioners in state law. Do you plan to seek a veto override of that bill, or are you looking to make further changes to bring it back?
We'll bring it back next session. But
Okay.
he also, as he did veto complementary healthcare, he also signed into law the licensure of naturopathic doctors. So, you know, I think it was a setback on complementary care. I'm very disappointed on that, but I do see the licensure of naturopathic doctors as a win.
Got it. Representative Subeck was wondering, can you weigh in on this medical marijuana issue? Where do you stand on these proposals?
Sure. So I haven't dove into the details of one proposal versus the other. At this point, they're both pretty fresh and new, and I don't think either of them is going anywhere in the assembly. I suspect, based on sort of conversation from leadership over the years and what we've heard them say publicly, that I'm not sure Republicans in the assembly are at the point where they're willing to move on any of this. That said, I find that disappointing. Certainly, at very least, we should be moving on medical marijuana. And in reality, we should also be moving on recreational marijuana. It is time that we regulate it. I do think ensuring that whatever we move forward with is appropriately regulated is really important, but we're being left behind as state after state, and particularly our neighboring states, have legalized marijuana, are now benefiting from the tax dollars of a well-regulated system. And frankly, it doesn't make any sense that we continue to make criminal activity out of things that shouldn't be criminal and in fact should be legal.
One audience question that we had that's sort of related to the issue of drugs. Lawmakers have moved to make alcohol more accessible during the pandemic. Recent Wisconsin Policy Forum report warned that alcohol-related deaths are on the rise. Do you think that there needs to be some action around this, like potentially increasing taxation rates on alcohol or other ways of kind of addressing this?
Sure. So this is an issue I've had my eye on for a long time. Prior to my time in the legislature, I served on the ALRC, or Alcohol License Review Committee in Madison, at a juncture where we were increasingly alarmed about the high rates of binge drinking and alcohol use here in our city and the detrimental results of that. I'm not sure that taxing it more actually solves the problem. I think we really do have to look at some of the root causes. I think this falls into some of the same arena when we talk about access to mental health care, access to addiction care is a piece of this. I also think there's some, and Senator Felzkowski talked about educating youth up front around sexuality and issues like that. On that note, I would bring back the Healthy Youth Act. But I also think many of those same things have merits here. That we have a culture of glorifying drinking. I did not grow up in Wisconsin. And I have to say the drinking culture was very different where I grew up. Thinking about my childhood, and some of this may have been my family, but I think it also extends out further that every event didn't have alcohol as part of it. Kids' birthday parties when I was growing up did not include alcohol. Here in Wisconsin, I see all the time people having birthday parties for their children, and the adults are all drinking alcohol. And while that's certainly a choice they're free to make, I think there is something to be said about our culture of drinking. And it is costing us. It is costing us in people, the price on families and individuals, the price of addiction. It's also costing us monetarily, and we need to address that. Certainly taxation may be part of that equation, but I think we first need to look to those root causes. We have to figure out how to change the culture, and we have to figure out how to do a better job of making treatment alternatives available. When I worked in the homeless shelter system, I remember working with individuals who were addicts, whether to drugs or alcohol, who were homeless, didn't have a stable place to live, said, I'm ready to go get treatment. We'd call a treatment program, and they'd say if they call every Monday, Wednesday, and Friday between 8 and 10, they can see if we have a spot for them. In our waiting list is 200 people long. And, that's unacceptable. I think that has improved a little bit since the days I was doing that work, but it hasn't improved enough. We've got a long way to go, and we can get there together.
Thank you. Representative Summerfield, do you want to weigh in on this? What more can be done to address alcohol-related issues in the state?
I mean, I guess, we've had beer, in our state of Wisconsin pretty much since we've been founded. We were founded on a strong, beer heritage with our ancestors. And this is where, our culture, some people, says it's not good to me. I see, what it does for our community events. These are things that, some people cannot handle alcohol. Same thing like, we were just talking about legalizing marijuana. And I think that's kind of the elephant in the room when we talk about the legalization of marijuana, especially for me, is, if we're going to demonize alcohol, what's the side effects of legalizing marijuana? I know you've looked at other states, there's potentially could be some other problems with that. But I think, the vast majority of people with alcohol consume it responsibly. However, it's the few that are addictive. I mean, they can be addicted to caffeine, marijuana, all these other sorts of drugs. And some of them, alcohol is their drug. And that's where trying to identify, teaching people, it's not good to go out get blackout drunk. That's, not the point of drinking. But there are people that, get addicted to it. So that's where in turn is to, look into, where we can help in society. I know drug courts have been very good. I know Chapel County has, I think one of the better ones in the state, a drug and alcohol court to say, hey, you've made a very wrong decision on this, but your life's not over. So let's figure out, is it an addictive personality? Is it because of how you grew up? You knew of nothing else. This is all your parents and your family members did, but there's another side to life. And I think that's where the most education that we can, tell people that alcohol is legal. It's a legal product to consume, but there are also certain responsibilities when you do consume this. So I think the more and more we continue to put the message out there, and I think it's been wonderful I hear stories, from the 50s, 60s, 70s, what it was to what it is now. I was at a forum the other couple months ago. I talked about alcohol policy, and they're pretty much saying that it's harder to get a case of beer than it is to get meth in a lot of areas, because our retailers who are selling the alcohol, have made very good strides in making sure they're selling it to the right people. So that's where, if they're not drinking, do they shift to another, vice? And that's where, with the alcohol policy, let's see, the people addicts, let's get them the help, seeing how we can, help them contribute to society.
Representative, where do you sort of stand on these medical marijuana proposals that have been put forward?
Yep, signed up Representative Felzkowski's bill last week, I think it is. I think the senator did hit the nail on the head. There's a lot of my colleagues that are uncomfortable, and even I would say even constituents, because I've had people come up to me on both sides saying, "Hey, Rob, you got to legalize marijuana," or "Rob, if there's one thing you don't do, don't legalize more drugs." And so I think trying to find the balancing act on marijuana. I think medical. I really appreciate Senator Felzkowski's all her work on this to get at least the ball moving. Because I think how she mentioned, why she didn't take up the smoking aspect, just do the patch. I've had, very strong conservatives come up to me and say, "Rob, you got to get medical marijuana legalized because my wife's, is on, very powerful pain drugs." And he's like, I wish we would have this option to help her with this. So it's been a long time of us working on this. I'm optimistic we'll continue to move the ball forward. If you could get this bill passed, I'd be super happy. I'm a realist, though. I don't think it's going to happen this session, but it'll continue to work and to see what other states are doing on the medical marijuana side to bring that to the citizens of Wisconsin.
Thank you, Representative. Senator Johnson, just was wondering if you could weigh in on some work on what the state can do around opioid overdoses and other sort of challenges that addiction poses.
Opioid overdoses, they're real. The same with, overdoses from other substances too. My family isn't immune to it. I lost my brother in August due to an overdose, my baby brother. And the one thing that I do know is that, families all over have been affected. The one thing that I think that we need to do is invest more money in mental health, because a lot of these substance abuse issues, they have underlying issues too. And mostly that has to do with mental health. When you talk about making marijuana a legalized drug, you're also talking about making it a safe drug as well, where people can go to a dispensary and buy a product and know exactly what's in that product versus having to rely on street buyers. And we know that with today's economy, a lot of those street buyers are lacing their marijuana with fentanyl and things like that because it's a quicker, faster high. And they can, spread out their product more. But unfortunately, it's costing lives. It's costing real people lives, real families devastation. And we have to do more about that. And the only thing that I can see to do is to provide more mental health services for those individuals that are facing substance abuse. And whether that means investing more in the pipeline using our state's resources, so we can not only attract more individuals into the field of psychology, psychiatric health, but also making sure that we can retain them as well. Creating incentives for our kids right here in Wisconsin to go to school and to major in those career fields, and helping to offset the cost. Using some of our surplus dollars would be an excellent way to build up those resources, because we have to do more. We have to start putting social workers and psychologists in schools, starting at very young age, and educating our kids about the real dangers of drugs, especially street drugs. And a lot of that has been started over the opioid issue. I know my brother, that's how he got his addiction. So making sure that we find a way to legalize marijuana, medical marijuana, is a good first start. It's the beginning start.
Thank you, Senator Johnson. We're fast running out of time, and I have one final question I was hoping that everyone can kind of weigh in on, and it is, what is the most important thing that lawmakers can do now to improve health in Wisconsin? So kind of a lightning round. Senator Johnson, do you want to start off?
For me, the most important thing that we can do in Wisconsin to help with healthcare is to expand Badger Care. We have used those resources to do some phenomenal work in terms of housing, lead paint removal, that are all associated with those Medicaid dollars, and making sure that the thousands of people who don't have insurance have an opportunity to have it, and also to help address those disparities that we are seeing plague our BIPOC community.
Thank you. Senator Felzkowski.
You know, I think one of the things is we always have this conscience on how do we help in healthcare in Wisconsin. I think number one is preventative. You know, too many times we talk about after the fact, after the obesity, after, you know, the hypertension. There's so many things we need to start talking about preventative, and how do we stay healthy from the get-go, and not just, you know, doling out drugs and after the fact care. There's controlling your weight, controlling your hypertension, exercise, diet. Those are the conversations we should be having, so we're not spending the billions of dollars on care. And people, you know, we talk about comorbidities and how that's affected us in, you know, with COVID-19. Number one is obesity, and very control, you know, that's something we can do something about. I want us to start talking about staying healthy, exercise, diet, whether we start that in our schools, whether we start that in our physicians' offices, wherever that is, so that we don't get to the point where we need all these expensive drugs and care.
Thank you. Representative Summerfield.
Yeah, I mean, I think quickly, you know, in the state, you know, continuing to look at, you know, how do we deliver the healthcare system better? You know, the APR and belt, you know, is a great, you know, step in that. You're also seeing what the new, you know, potential, what the future is. Looking into telehealth, you know, I mentioned that before. I think that's one of the biggest things that could drive down costs, and continuing to think outside the box to see, hey, you know, this maybe hasn't been tried anywhere. Let's try it here in Wisconsin to make sure that we have good health care for the future.
Thank you. And Representative Subeck.
So I generally agree with much of what all of the other speakers said on this. I particularly agree that we need to address prevention. And when you were talking about addiction and some of those issues, and we're always talking about we don't have enough treatment, I think that's a great example of where does the prevention come in? And that boils down to mental health resources. We have got to tackle mental health better. We have got to deal with trauma. And we have to start looking at the social determinants of health, realizing the connection that environment, not just physical environment, but your entire well-being has on health in the long haul. And that is one of the most important things we can do to close those disparities, which brings me back to what Senator Johnson said, which is we can do all of that if we expand Badger Care. That is where we can get the resources. We can bring the tax dollars that our residents have paid to the federal government back into the state and reinvest them in the healthcare of our state, and really begin to take a serious stab at tackling these tough, weighty issues.
Thank you. Just wanted to again thank all the panelists for participating. I know things are very busy in the Capitol these days with things wrapping up, so really appreciate the time. Thank you for everyone for tuning in and watching this, and have a great day.